Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
As a clinician, you're going to have to ask yourself, which blood test gives me more information about a specific individual over another one? Today, I'm going to discuss magnesium serum versus RBC magnesium. There is a difference. The problem is the serum magnesium typically represents only a small fraction of the magnesium, which is about 1%. That's all. So the majority of magnesium is typically found in the bones, 60 to 65%, with about 30 to 35% in the red blood cell, which is generally estimated in the red blood cell to be 20 or 30% of the body's magnesium. Now, one reason why serum magnesium don't give you the good picture as obviously 1%, it doesn't represent the body's stores. So you need a better test to know how you should clinically replete these people. Serum magnesium is the liquid part of the blood. It's after the clotting factors are removed. The normal range is between 1.7 and 2.2. And of course, it is limited again and misleading often. And factors like hydration, renal status, acute injury, all of these can affect that magnesium level. Now, in comparison to the red blood cell determination, concentrations are within the red blood cell. They have a longer life, typically 120 days, give or take. The red blood cell magnesium is often considered much more accurate in testing. It's like other intracellular types of metals like potassium and zinc, which we'll talk about soon. Patients with chronic diseases, metabolic disorders, or symptoms suggestive of magnesium problems should be looked at as the metal component or the red blood cell magnesium. And one more thing you should know. Minor changes in a serum magnesium, like from, let's say, 2 to 1.8, they represent a significant loss in the intracellular or red blood cell magnesium level. So it behooves you, other than acute situations, when treating chronic individuals, to heavily consider using a different method of determining someone's magnesium appropriately. That would be the red blood cell magnesium determination. I've had cases in the past, one comes to mind immediately as a young fellow, 14 years old, who was expecting to become pretty much a college tennis player, had severe pain, had been to the major institutions in our area, which basically said they couldn't find anything. And again, I said, let me look at the magnesium level, which they did only serum. When I did the red blood cell magnesium, it was low. And repletion, both intravenously and orally, changed this boy's life forever. As a matter of fact, so much so, he realized that he'd like to go into medicine and be somewhere in the integrative medical space. Next time, more information on zinc RBC. I'm Dr. Mitch. And if you'd like to send me any information or have questions, you can always go ahead and write me at Dr. Mitch at MitchGhen.com. That's DRMITCH at MITCHGHEN.com. Thank you so much for watching.